fuel. It's an emotion. We don't just eat to live. We live to eat, celebrate, and share the joy of every bite.
এখানে মেনলি সন্ধ্যেবেলায় প্রচুর লোক আসে, অনেক দূর থেকে এখানে খাবার খেতে আসে। এখানে সমস্ত দোকানে খুব ভিড় হয়।
আর এখানে আসলে নির্দ্বিধায় অল্প পয়সার মধ্যে দিয়ে উন্নত মানের খাবার পাবেন আপনি আমাদের এখানটায়।
India is one of the few places where a meal isn't considered complete without something spicy and something to cool it down right after.
আমার স্পাইসি ফুড খেতে যেরকম খুবই ভালো লাগে, শেজওয়ান মোমোটা খাচ্ছি। এটা খেলে অ্যাসিডিটি হবে আর এটা অ্যান্টাসিড খেলে অ্যাসিডিটি চলে যাবে।
তোরা স্পাইসি হয় না খাবার, যেহেতু আমি ফিটনেসের মধ্যে আছি তো আমার এটা মেনটেন করতে হয়। তো আমি এখানে বেশি বেশি শর্মা রোল খাই।
স্পাইসি খাবার, ফ্রাইড আইটেম, বিশেষ করে চিকেনের উপর সমস্ত আইটেম এখানে প্রচুর সেল হয়।
Beyond food habits, there is another serious issue: drug-induced gastritis, NSAIDs, aspirin, and certain medications we prescribe daily can damage the stomach lining, leading to ulcers, pain, and long-term complications.
Many patients assume acidity is just a side effect, but prolonged NSAID use can lead to serious gastric damage even without noticeable symptoms. PPI have been the go-to solution, but is there something better?
Yes, we can.
আরে কি ব্যাপার
সকাল সকাল ফুচকা।
So this is the beauty of Calcutta food. Anytime, anywhere.
First take the fuchka, then we will talk.
Have you taken a PPI before this?
Forgot to take.
Not required now.
No, it is required.
If you have problem, you can take Vonoprazan.
Okay. Even after food?
Even after food, you can
Okay,
take.
that's great.
Start the fuchka. It is really good.
Okay. So कितना करके दे रहे हैं? 20 की 4. Don't count. Just keep having.
In our Bengali culture, we have multiple cuisine. Fuchka, kebab, biryani, payes, khirkodom, rasgulla, mishti doi, luchi puri.
Everything. So spicy, sweet. And one thing is that during our student life, during Saraswati Puja, after the puja, you can get the mude. And all fried. Luchi, Radha Vallabi, Beguni.
It is not completed with labra, without labra and beguni. So labra is must.
And don't forget the famous aloo chop.
Good morning, Dr. Pal.
Morning, good morning.
Good morning. Good morning.
Too many specialties are here today. What happened? New venture, anything?
I think maybe only one thing that is common between all of us, ortho, gastro, medicine, and that is what else than a drug-induced gastritis? What do you say?
Yeah, I have to deal with all this. Like you guys are prescribing and say it's right and left, and I have to deal with these patients. They all come to me with various types of complaints like pain abdomen and sometimes also with bleed, you know. So because of the rampant use and over-the-counter use of NSAIDs also.
That is one thing I just want to emphasize, that the more than that, from our side prescription,
Yes.
the prescription served by the counter,
Yes.
and that is basically not as per their choice,
Yes.
not the patient choice or the proper indication.
Yeah, because that's correct. Because I have seen orthopedicians prescribing more like ointments, local applications for pain. But people, when they don't go to doctors and they buy some, maybe somehow they come to know about the painkillers and they misuse it. But this gut-related problem is really a big
Do
thing.
you really blame the drug-induced gastritis or the foods we are having in every occasion? In Bengali, 12 মাসে 13 পার্বণ, we have multiple occasions and various types of food specially made for particular occasions.
That is also added, the gastritis, I think. So is there anything new?
Normal
in your
practice,
mind? Yes.
in normal practice, they come with different types of explanation of the symptoms, like পেট ফুলে যাচ্ছে,
No, the maximum is the
বুক গলা জ্বালা,
বুকে গ্যাস জমে গেছে।
এবং সেই গ্যাস কোথায় যাচ্ছে ঠিক নেই, it may go
মাথায়-
anywhere.
It's like every Bengali has a problem with acidity,
Yes.
and সবারই গ্যাসের ব্যথা
So
হয়।
you should
and
not omit the or the avoid the food problem, because we love food We enjoy our food.
It is our daily life.
Yes.
It is in our
Without
daily life.
that, the Bengali life is completely incomplete.
Yeah. And also Bengalis are prone to move here and there. And every time there is a break of discipline.
So in India, see, we cannot take away food from our life. That is very important, and we cannot take out this what the chaat or fuchka and all this type of food. Also, you cannot take out biryani. So this has to be there. So we have to like devise somewhere like we have to live life in moderation. It's like you eat food also, and at the same time you take medicines if it is required. Not always medicines will be required.
So you actually want to tell there is a life balance.
Yeah, you have to maintain a balance.
Also, in our condition, we have to write painkillers inside. If suppose
Problem is that
post-operative injury,
like
but at the same time, we need to protect them also.
the alternative medications like homeopathy medications or the Ayurvedic medications, the unsupervised medications that are very important, because whenever the orthopedicians write the painkillers, it goes long time, at least for 7 days, 8 days or 10 days.
And then they will go to the counter and add 1 week more by themselves.
And in case of physician, from our part, we generally prescribe the aspirin molecule in
This is
elderly
basically
patients.
elderly patient, yes. So they are regularly taking the aspirin, and that also cause the gastritis. So I think, Dr. Pal, is there any new molecule?
So if you look at the history of this acid control, like first in 1930s when the antacids came, though the scientific evidence came a lot later, they give instant relief, but the long-term effect is not there. Antacids. Nowadays also we use antacids, so many syrups and all this. I don't want to take any names, but so many
That was
syrups
the
and
primitive
also.
one.
That's the primitive one. Then came H2 receptor blockers. So H2 receptor like your ranitidine, famotidine, and all.
Famotidine, yes.
These are good drugs.
Yes,
Till
yes.
now we use famotidine.
In our
It's not a
hospital,
problem.
there is a typically famotidine.
Those two are easily available.
So let me tell you, the only problem with these drugs is tachyphylaxis. So if you keep on giving, after some time this will not work. So this is the problem with these drugs. Then came that new the miracle medicine like PPIs.
CPIs.
So that came in say 90s, 1989, 1990 it was introduced. And PPI has been a wonderful drug. But there are certain problems with PPI, let me tell you, like PPI we need to give it, like it takes a long time to act. Suppose someone is having acidity, you give it today, it will take 3 to 4 days to attain a steady plasma level.
But as the time changes, we need the instant relief.
Yeah, so we need instant relief. The other thing is there are concerns of PPI as a most important, like the cardiologist, physicians, no? There are chances of drug-drug interaction because this is metabolized by cytochrome C219. So a lot of drugs are metabolized by this. So that is a concern. So there was always, we were in search of another molecule with something, as you have asked, whether there is anything new.
Nowadays, a lot of patients also say that even I am taking the PPIs, I am not feeling better. We used to feel better. And especially in older
Yes,
patients,
the
geriatric patients.
populations are increasing, and there are multiple polypharmacy, multiple medications are there, because they carry multiple comorbidities also.
And sometimes what happens in practical life, people consult with one doctor, immediately day after one or two, another doctor. So he or she have already 2-3 molecules with him or her inside the bag. So only 2 days, suppose PPI, one like of pantoprazole, then again after 2 days the rabiprazole.
No, generally see that our prescription starts with a PPI without any other cause. But if you don't give the PPI to the patient who is taking multiple medications, they will not be satisfied.
Yeah, and
And
also
they will also ask you to give some medication because they are feeling some bloating sensation
and
or
even
something.
you not write all those
Yes,
things,
they will
suddenly
they will buy
during
from the
just
counter.
leaving your chamber, coming out with a strip of pantoprazole. Sir, मैं तो सुबह पर एक करके ले लेता हूँ.
Right. So see, the other problem is what I feel, this is a really practical problem. See, most of the PPAs are now combined with domperidone or levosulfide.
Yes.
So, and people see PPAs don't cause any harm, much harm to the body. The problem is due to the combination with domperidone, levosulfide. So, these type of drugs, because of it's available as a combined medicine. So people, suppose someone is taking, suppose pantoprazole combined with domperidone, And if they don't have adequate control, the one tablet they will take in the morning and one tablet they will take in the evening. So that makes around 60 mg of domperidone. Can you imagine 60 mg of domperidone? So we are always in the search of a new molecule.
জীবনে কি পাবো না ভুলেছি সে ভাবো না সামনে যা দেখি জানি না সে কি আসল কি নকল সোনা পা 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 পা
টুইস্টটা হইয়া
So the new molecules that I was talking about, this new drug has come called Vonoprazan. So actually it's new for us, but this has been there since 2014.
as you told
Yeah. So Japan এসেছিল in 2014.
Japan
হ্যাঁ, তো এটা is successful. তারপরে US FDA they approved in 2023, and in India almost 1 year we have been using this drug now. It was launched last year.
So what is the basic difference of the previous things and which is you told that new come?
So there are a lot of differences between Vonoprazan. So first is the mechanism of action. First of all, what we should remember is PPI is a pro-drug. So whenever we take PPI, that needs to be converted in our body to another form which will ultimately work. So as you know, that inhibits the proton pump inhibitors. This is known as proton pump inhibitors. Whereas Vonoprazan works on hydrogen potassium ATPase pump. And another major difference is this reversibly binds Vonoprazan. So একটা hydrogen potassium ATPase ke pump ke inhibit করলো, it can dissociate from that and can inhibit another pump. Whereas PPIs they bind covalently. That means irreversible binding. So this is one difference. এর জন্য the mechanism of the duration of action, and the other thing is PPI requires acidic environment to work. ও যদি অ্যাসিড না থাকে
So
তাহলে ও
you
কাজ
actually
করবে।
want to tell that the previous drug we have to put it in a particular manner or
Time.
particular time.
Time.
and
But
it requires
this
activation
Vonoprazan
also.
is anytime, anywhere. Is
So
a-
it's very interesting. Yeah, so it was very interesting. You will understand. Like there was a study in India which showed that almost 70% of physicians and even 30% of gastroenterologists, they don't advise adequately to the patients when to take. Like suppose if you take my instance also, sometimes I loosely say, okay, take it before breakfast. But how long before breakfast? At least it should be taken 30 to 60 minutes before breakfast. তাহলে কি হবে? Acid will be maximum at
but
that
in
time.
practical life,
Hmm.
most of
That
the
doesn't
them
happen.
doesn't take place actually.
And other problem is that the person taking the thyroid medications, they can take the PPI and the thyroid medications at the same time. The problem is the absorption of thyroid molecule is less and the effect is less. And many drug interactions are there with the PPI along with the cardiovascular medications like clopidogrel, etc. And so we need something different that can be, because the compliance is very important when the patient should take the medication. If
So
you forget,
I was coming to that particular point. Like as I said, so this Vonoprazan can be taken irrespective of food.
Okay.
So you can take it anytime. And because most of the times PPI people will forget to take before breakfast, they will
Yes,
take just after the
just after
breakfast,
breakfast.
and it doesn't work.
And whenever they feel, some burning sensation, acidic problem, they will take. And even after having a good meal in a occasion,
So মধ্যরাত্রে উঠেও PPI খেয়ে নিচ্ছে।
yes.
So that doesn't work. That's why, and people say that PPI is not working because that time bound factor is there. So the advantage with Vonoprazan is it can be taken anytime. It is more potent. It's more potent, and it's also if you see the half-life, it works for prolonged duration.
and it is
like,
quickly acting.
It's quickly acting. Quickly acting, that I was telling, because it doesn't require active proton
Yes,
pumps.
yes,
It
yes.
can work in
So it
both
is-
the ways, reversible.
Right.
Probably the PPI take at least 4 to 6 hours to take the action. But if you take the Vonoprazan, it is quickly acting, and it is 2 hours. Within 2 hours, it starts acting. So it is a very magical response of Vonoprazan.
So the other thing that I was coming to is there is a concept called nocturnal acid breakthrough. So if you take PPI in the morning, মধ্যরাতে দেখবেন খাওয়া দাওয়ার পর someone is getting up with acidity.
Yes.
And that's why we reflux, and also because PPI, the half-life is around 2 hours. So that steady plasma level is not maintained throughout the day. Whereas this has got a prolonged
So
half-life of 7
actually
hours.
you want to tell us that even after a full meal, suppose diabari, you can take this easily and you get a good result out of that.
That's because it comes in the mechanism of action that this does not require acidic environment to work.
Right.
So you can take at any time. So this is one major advantage of Vonoprazan.
Do you have any study, head-to-head study regarding the efficacy of the Vonoprazan with any PPI? Which one is potent?
Yes, so there are multiple studies, no, like which compared Vonoprazan with PPIs. The most studies are with lansoprazole, head-to-head comparison with lansoprazole, and in all the trials they have shown that they are non-inferior. So Vonoprazan is non-inferior to lansoprazole, or maybe superior in aspect of side effects and also the duration of action.
Probably the erosive gastritis or the GRD problem.
So the initial studies of Vonoprazan was in erosive esophagitis, but now it has been proven that it works in non-erosive, in NARD also. Non-erosive reflux disorder also, this works equally.
Because it does not require activation and you can take irrespective of food, it must be better. Patient compliance will be better. Patient will stick to the medication. So ultimate result will be much better.
Want to mention the Helicobacter pylori infection, which is very much common nowadays, and now it has been proved that it is one of the most bactericidal resistant bacteria which is causing the gastritis. And probably as I think there are few studies which showed that the Vonoprazan is effective to the Helicobacter pylori infection also, and it can eradicate with the combinations of few drugs. If you compare with the PPI, so it is equally effective or much more effective than the PPI in eradication of Helicobacter pylori infection. That is also important.
So another thing here I would like to stress is, there is one study which showed that normally in H. pylori we give 3 drugs,
Yes.
2 antibiotics, 1 PPI. Here, Vonoprazan along with 1 antibiotic only, amoxicillin, it has shown to have very good action, comparable
Only
efficacy.
2 medications, it decreases the unnecessary use of other antibiotics, the side effects of other antibiotics. So only 2 medications can eradicate the 90% of the Helicobacter pylori problem.
It's a great benefit, I would say.
And another thing is that in our daily practice, we see that the bleeding from the ulcers and the rebleeding from the anastomotic ulcers, the JV anastomosis or the variceal bleeding or something, will it be effective in case of this type of bleeding?
Yeah, because it is more potent and causes acid suppression for a prolonged duration. Naturally, because what we do in varices, when we apply bands, once the band slips off, then it can bleed again.
Yes.
So that if we have a drug which suppresses the acid more potently, then it's going to be beneficial.
So, Dr. Pal, let me share one story of my patient with you. That one of my patient who used to take PPI once a day, he had a history of gastritis before, bleed before, which is treated. But because he came to us for injury, so we had to prescribe NSAIDs. We don't have any other options. Then again, after few days, he landed up in rebleeding. He used to take twice the PPI, but again, it was not controlled. So as we were discussing about Vonoprazan, is there anything advantage or is there any scientific data that you can share?
That's a very good question. So let me tell you that there is robust data now available with us about this drug-induced gastritis, the role of Vonoprazan in drug-induced gastritis. So I will talk of a trial, that phase 3 multi-center trial, which compared Vonoprazan with PPI. And it was a double-blind randomized trial with a long duration, like 24-week trial with extension up to 1 year. And here a large number of patients, more than 600 patients were included, and the risk of ulcer on NSAIDs was assessed. And in this study, it was compared between Vonoprazan 10 mg, 20 mg versus PPI. And it
Which
was
PPI?
Lansoprazole. Most of the studies are with lansoprazole. So this trial showed that Vonoprazan are non-inferior. And in the extension arm, it was seen to be better. The tolerability was better than PPI. So this is about drug-induced gastritis. So any data which has 600 patients.
Half-life of this particular
Half-life
molecule?
is 7 hours.
7 hours.
7 hours. So it has got a longer duration of action. So that takes care of the nocturnal acid breakthrough. So here I will talk of another study which showed that this is the molecule which has around more than 60% of the patients, it maintains a steady plasma level. So the nocturnal acid breakthrough is taken care of. So you can take a single dose. Otherwise, one practical tip which I will tell my
So
patients, you
night
can also.
reflux,
It's
gut
not
reflux
that.
is taken
So
care
another-
of.
that is a very-
Another thing what
that
you
is
can
very
do,
problem for
yes,
many
what you
patients.
can do in a practice which I do is we see the patient when they are complaining of the symptoms more. Suppose someone says I have early morning symptoms, then I usually tell them take it at night.
Night, okay.
Because in the morning if you take some amount, effect will weather off by morning, next morning. So this is one more thing you can do. So there was one more trial of this in low dose aspirin patients. This was also a large trial, more than 600 patients. There also it was a randomized non-inferiority, around more than 600 patients trial, where there is a single blind again extension. So let's not go into the details of the study, but
So what you suggest in case of aspirin induced, as we have the geriatric population much more in day by day.
Most of them are taking F.
So
The
is
thing
it
is
as you discussed, whether you suggest you should start this molecule with the aspirin immediately,
Now,
or
the
you can
thing is that you should not start aspirin randomly.
no I
because
mean proper
be-
indication
yes,
patient where you
it
use
is- it
supposed
has
to use
no
the
role
aspirin.
in the primary prevention. So it should be prescribed only for the secondary prevention. If you have any ischemic
So
cardiac
there
disease,
is no need to
atherosclerotic,
give
no,
that
no.
molecule with
With
the aspirin
primary prevention.
immediate primary.
primary prevention,
That is the
whether
thing.
the patient is
So
suffering from diabetes or
concept is clear.
hypertension. So you should prescribe with
If there is
full
any complication,
justification. Yes,
later on.
justification with the aspirin that it should not be used in primary prevention. It has no role from the studies done. So it should be given for the secondary prevention. And if you give the aspirin, then it is your part. Please tell me what should we do if the patient is on aspirin for a long time.
So
What
see,
will be
my
the-
practice if on aspirin also, not that I have started aspirin, so I will start one PPI or Vonoprazan also. Only if the patients are symptomatic. Otherwise, you will be abusing the drug. So here again, someone is symptomatic while on aspirin or on NSAID, then only we will give these drugs. And in these two studies have shown that is better than, or if not better, you want to say if it at least non-inferior to PPI. And taking into account the other beneficial, more potent, longer, so you
Dr.
definitely
Pal,
prefer
till
this.
now we are discussing about the drug as per our daily life. But what do you think about the street food? Kolkata street food.
So food you have to take. We cannot take away food from people's life. Like if you tell patient don't have this, they will not come to you.
No, the charm of
Okay,
life is
so-
this good
Yeah,
food.
so food, I will say, food you take, live life in moderation, do physical activity. If required, take medicines. With food, there is absolutely no problem. Only thing, like I said, it should be hygienic. So I am not worried about gastritis and all with
No,
this food.
sometimes the concept is that
Yeah.
we are taking some street food and immediately we have the Vonoprazan, we will take that. Is this
No,
concept
this
right?
should not
No,
be done.
yes.
Unless you are symptomatic, you don't. But what you should be very particular is about the drug-induced gastritis. Yes. So drug-induced gastritis, people who are on NSAIDs or aspirins, and if they are symptomatic, then they have to be treated. For food itself, I think it should be hygienic, and whatever food you take, unless you are symptomatic, don't take.
Anytime if you in Calcutta or any places, you have to take all those things, and that is delicious. And you can see here we have the fuchka here.
Can you explain any drug-to-drug interaction with the Vonoprazan which we have with the PPIs?
So that's what this PPI usually is metabolized by CYP 219 enzyme pathway, and so it has got drug interaction with clopidogrel and all. But Vonoprazan, fortunately, it is metabolized by some other pathway. One
So there is no interaction with this.
CYP2E3 like that one pathway. So as of now, we don't have any interaction of Vonoprazan with other drugs. And one thing, last thing, like we are always concerned about long-term PPI side effects and all.
Yes, yes.
So there was a big trial called Vision trial, which had the data up to 5 years. And this study has shown there are almost known side effects with
From this particular
Vonoprazan.
Vonoprazan.
With Vonoprazan. And what we are worried is there were initial some reports that there are tumors due to intake of PPI, which is physiological also. Like when you take PPI, it will suppress your acid. When it will suppress your acid, the gastrin level will increase. And will this gastrin cause tumors? So till now with Vonoprazan, nothing has been seen. Only 1 or 2 adenomas were found, but that was not significant.
Any other side effects? Any other side effects like
See, the only side effect, that can be, though it has not been reported, is because it is more potent, what will happen? It will cause more achlorhydria. That means the acid will be lesser, and that can predispose to infections. So, because long-term elderly patients, if you give PPI, because as acid, God has given us acid for a purpose. If you always neutralize the acid, the infections that we eat with our food and all, those will not be neutralized. And that can predispose to infection. So that is the only worry, because it is more potent.
Another point I just want to ask you, there is a tendency to take the excessive dosage because someone is not responding with pantoprazole 40 milligram, he will take another 40 milligram before dinner. The Vonoprazan, can it be taken twice daily? Is it really workable, or it should not be done? From our message, what should be our
So
message?
our study till now, which data we have, and if you look at the mechanism of action, once day daily dose is enough. That's what I said. You can tailor it as per your need. Like, when is the acidity more? If it is in the morning, take it at night, because it has no food interaction and all. But no need to take twice daily, because it's a very potent acid blocker. If you cause maximum acid block, or if you block all your acids,
Then
it can
definitely
cause harm
there
also to the
call-
patient.
So PPI is like you need a good, it's like it need a balance. Then only it will work. Vonoprazan is like it's good for all.
So, in every aspect of life, there should be some balance.
Another question, sometimes the symptoms are somatic. Patient do not feel any type of relief from taking any medication. Can it be taken with the PPI? If the patient take the PPI in the morning and Vonoprazan at the night, is it justified or it should not be done?
No, scientifically it is not justified.
Yes,
Because though the mechanism of action is different, the end result is same, suppression of acid. It will lead to more side effects. So I don't think we should take even twice daily dose of Vonoprazan is also not required, and combining with other drugs also is not required as of now. The scientific data says.
And how to quantify the doses? Whom to give 10 or whom to give 20?
So initially the studies have shown you start with 20, and once the patient is better, you can maintain on 10. And this data comes from erosive esophagitis.
So, is there any specific time like 6 weeks or 8 weeks?
So
Or
2
it
months
is absolutely
Yeah,
symptomatic?
So normally what I do is, we usually start with this drug, and once the patient responds, then you gradually taper down and tell them take it on demand.
Right.
You keep it at home. If you're feeling symptoms, you take it once daily. Then after 3 days, you can repeat. Like that, whenever required, as and when
Customize.
required.
Another
Customize.
thing I want to ask, sometimes the main problem is heartburn, the acid reflux. So we introduce the domperidone or some prokinetic agent to decrease the motility disorder.
Yes.
So is it possible, or is it in the future that the Vonoprazan will come with the domperidone or any prokinetic agents, or the Vonoprazan is sufficient to act on any reflux, which is a motility disorder?
So very good question. So DCGI has not given approval for combining Vonoprazan with domperidone or any IT or L.
Okay.
So, and that should not be done also, because if you combine, then what happens? No, patients take off the level, the drugs. Yes. So they will take twice daily. So you end up giving 60 mg of domperidone, which is very, which is not at all. So if someone at all has got this nausea and you want to give it separately.
Separately, yes.
Give domperidone 10 milligram twice daily, and tell them you stop once your nausea is over. So that is what.
So, what we discussed till now, the new molecule, this Vonoprazan is very superior with the previous drugs which is already in our markets, and we can take this molecule anytime. There is no time bound which previously we have.
In case of gastritis, particularly the drug-induced gastritis with aspirin, it is one of the superior drug in comparison to its ancestors, that it can work very well, and we can start the medication if the symptoms arise.
And one of the best part is that it does not require activation. So it acts spontaneously very fast compared to your PPIs. So according to your pattern of having the problems of acidity or reflux, you can take. And it is very efficacious, very superior compared to other medications in drug-induced like NSAID-induced gastritis. So in our patients, we have to prescribe them for their pain and other issues. So Vonoprazan is here to take care of that.
So what comes out ultimately is Vonoprazan is a new molecule, it's a new kid on the block. It's here to stay because the studies, the evidence has shown it is way better than the existing molecules that we have. It is rapidly acting, it acts independent of food, long acting, and without any interactions. And it can be used in drug-induced gastritis also, and with absolutely very less side effects, no side effects till now the data says. So enjoy life, eat food, but all in moderation.
In drug-induced gastritis, Vonoprazan is the
Right choice.